And one of the first topics that I zeroed in on that would give us new information was PPE. And they had a panel discussion that had a very engaging title, How We Got in This Mess and How We'll Get Out of It. And the panels on there were made up of experts in the field, and mostly on the manufacturing side. Okay. Rick Cohen from Benco did a presentation and was one of the panel discussion, of course, on the supply chain with it. Sean Gregg from 3M with all of their mask and N95 respirators was. And then Dennis Adams from Denline. They make disposable gowns and reusable isolation gowns, talked about the shortage of isolation gowns. And then finally, there was a new member, William Harris. He goes by Billy Harris. I did not know him, but he spent his entire career in the glove manufacturing arena. So he knows manufacturing of gloves. He's semi-retired, still an advisor and consultant at this point, but he talked about the circumstances with gloves on there. So interesting panel of experts with in-depth knowledge of the supply chain, cost, and what we're going to be faced in the future with PPE.
Okay. What were some of your takeaways in terms of what we'll be facing in the future?
Well, there's some good news. Okay. We all are looking for some good news on it. And one of the things that came out of there that with Sean Gregg and Rick Cohen both talking about masks is that it looks like mask shortage toward the end of the year, the supply chain may get full. And we're going to be back and able to buy masks, and the price may even come down. One of the comments was made, now we may not have as big a variety of selection. We may not be able to buy lavender mask or pink mask. They only have a choice of blue and white mask. Okay. One of the things that Sean Gregg emphasized, though, was that at this time, manufacturers are still, they're under DPA. That stands for the Defense Product Act. Yeah. And under that DPA Act, the manufacturers of especially the N95 respirators, we've got to replenish the reserves, the FEMA reserves, the emergency supplies. So they're going back in, and those supplies that were released during the crisis for frontline care providers and to orthodontic practices, those supplies have to be replenished. But they're anticipating that that'll be replenished hopefully by the end of the year. Now, Dennis Adams on there in Denline and talking about with the disposable gowns, his information was not quite as, let's say, positive. We're going to continue to see shortage of disposable gowns because the material that's used to manufacture them, it's referred to as an SMS material. There's only a few machines that make this spun-bound, melt-down, spun-bound material, and there's going to be a limited supply. So he really did an analogy of going to reusable gowns. And the cost savings that an orthodontic office could have in using reusable gowns. And it was almost a 50% cost savings. And then he also compared that to using a laundry service, you know, where you maybe rent the gowns from a laundry service. So all of those can be either buying your own gowns and laundering them in the office, or using a laundry service, or renting, like you rent from a uniform company. Those can all be cheaper at this point than using the disposable gowns. So that might be something for orthodontic offices, if they have not already investigated it, to go ahead and look at that. And then the final discussion, of course, was gloves. Most orthodontic offices, they go through a lot of gloves. If they're seeing anywhere from 60 to 80 to 120 patients a day, you can imagine the number of gloves. Maybe they change gloves twice during a patient's care. So they're going through a lot of glove boxes. And what Billy Harris referred to in this is all the glove manufacturing has really moved, as they say, offshore. It's out of the Malaysia area. A lot of glove manufacturing started there because that's where latex is harvested. And it was cheaper to manufacture the gloves where the latex is harvested than it was to ship these huge, heavy latex bundles to the United States. Gloves used to be manufactured in the United States and then fabricate the gloves from that bulk or raw latex in the United States. So in years, even the non-latex gloves, nitrile chloroprene gloves, they're all manufactured in Asia, if you will, at this time. So the factories have been shut down. They've been mothballed in the United States. There's a possibility that they could reopen, but it would take a major overhauling of the equipment in the physical facility to even do that. And because of the pandemic and the infection control that's recommended for SARS-CoV-2, the rest of the world that was not wearing gloves for routine dental care and medical care, they're implementing that. In the United States, we've been wearing gloves routinely for 20 plus years, 25 years.
Right.
We really changed in the mid 1980s and it's become a standard. But the rest of the world was not routinely wearing those gloves for patient care, both in medical and dental. So now with the pandemic, heightened awareness of infection control, the rest of the world has now realized the importance of wearing PPE. And so there is going to be a huge demand on gloves. And the prognosis, if you will, for that was that we could see a shortage of gloves for the next 3 to 4 years, as well as increasing cost. So I would, as a consultant, I would advise ortho teams to look at how can you preserve your gloves. And one of those will be to, when you sit down to treat a patient, have everything that you need in front of you so that you don't have to get up to go and get another bird beak plier or a 3-prong plier or something that you missed on the setup with it. And that would preserve having to take off your gloves, sanitize your hands, and put on another pair of gloves. Another savings can be to use the utility gloves in the sterilization room. When you're cleaning instruments, when you're packaging them for the sterilizer. For convenience, many ortho assistants prefer to use the exam gloves in the sterilization room. They have more tactile sensitivity with them and they're easy to get on and off and they're clean, but we can successfully use those utility gloves. We've always supposed to use them when we're handling loose contaminated sharps, such as a ligature cutter or an explorer or a scaler, that after it's been cleaned that we're packaging it. But I've seen a lot of lax procedures, again, for convenience of using the exam gloves. So going to using the utility gloves, and they can be disinfected and sterilized, and that will help to preserve those. Yeah, so good information, optimism about masks. By the end of the year, we're going to have the supply chain replenished, but then we could see ongoing caution and shortages and increased prices with the gloves.